Assalamu alaikum wa rahmatullahi wa barakatuhu. As you can see, today's session topic is mental health and Jinn Possession, and this topic will be delivered by Dr. G.Hussein Rassool, inshallah ta'ala. So before I give the mic to Dr. Rassool, I would like to give a brief introduction of him, inshallah. Professor Dr. G. Rassool has a PhD in Psychology and Education from University of London, MSc in Health Education and a BA in Psychology. He is an international consultant and facilitator with proven expertise in mental health and addiction. He is currently working as an academic advisor, lecturer in psychology, independent consultant in addiction and mental health, and clinical consultant, executive director of Sakina Counselling Institute and Research. He also works part-time as an Islamic psychotherapist. Dr. G. Rassool has been a visiting professor of psychology of addiction and mental health at the University of Sao Paulo, Brazil. His previous experience was a senior lecturer at the Department of Addictive Behaviour and Psychological Medicine, St. George Hospital Medical School in University of London, England, where he developed many unique academic programs. He is a fellow of a Royal Society of Public Health and served as a news editor, editorial board member of international journals in the UK, USA and Brazil. He is an author, editor of 8 books and has published over 100 papers and reviews.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وصحبه ومن استنى بسنته يوم الدين. All praise is due to Allah, and may Allah peace and blessing be on the last Prophet Muhammad sallallahu alaihi wasallam, and to all those who follow the path of righteousness until the last day. قال رب اشرح لي صدري ويسر لي أمري. السلام عليكم ورحمة الله وبركاته. Welcome to this session on mental health and Jinn Possession. And we're going to focus in this session mainly on the Jinn Possession and mental health, but we're going to have a quick overview of, what is mental illness and some of the epidemiology, more or less, some of the prevalence of mental health problem among Muslim population, causes of mental illness and types, very, very briefly, but we're going to focus more on Jinn Possession and mental health. So I think to start with, we need to think about that taking good care of one's health is a religious duty. It's a religious duty because Islam attached great importance to health. So our Creator, Almighty Allah, has bestowed health, as one of the great blessings on human beings. So, for example, there's a hadith by Bukhari, Imam Bukhari, Prophet Muhammad sallallahu alayhi wa sallam said, there are 2 blessings which many people do not appreciate, health and leisure. He also said that no blessing other than faith is better than well-being. So health is very, very important. And that when we talk about health in this context, we're talking about physical health, psychological health, as well as spiritual health. Because the word health itself is holism, it's holistic. The word, it's an Anglo-Saxon word, means holism. So when we talk about health, we're talking about the physical, psychological, or psychosocial, and spiritual health. Now, what is mental illness? Now, the American Psychiatric Association define it as a disorder that affect a person's cognitive in thinking, their social, their emotional, and behavioral state, or their particular abilities. So in a way, a mental illness is a condition. And this condition impacts on people's way of thinking, the way you think, the way you feel, but also it affects your mood. And when it affects your mood or the way you think, you feel, or affect your mood, it affects your ability to relate to others. Basically, it affects your ability to communicate with others, to have interpersonal relationship with others on a daily basis. So each person will have different experiences, even though people with the same diagnosis, but they would have very, very different experiences. When we look at mental health, and mostly in the world, there are no epidemiological studies. There are no big studies. Even if you look at the 57 Islamic states who are members of the Organization of Islamic Conference, very, very few countries they look at incidence or prevalence of mental health problems. In fact, according to Pridlo and Pasha, there's no satisfactory single description of mental health services, especially limited in English language. Although there are some services developed in the Middle East and Far East and Indian subcontinent, nevertheless, it's not comparable to the type of services we have in the Western Hemisphere or Northern Hemisphere. But when you look at the different mental disorders, or psychiatric disorders, you find that schizophrenia is similar to numbers. So, which means that if you look at the rate of schizophrenia, is no different in terms of incidence or prevalence between Muslim and non-Muslim. So everybody suffers from this particular disorder. In terms of post-traumatic syndrome, then there is the high rates. But again, we need to look at all the different reasons behind it. Why there are a lot of post-traumatic syndrome disorder. War, famine, earthquake, all sorts of calamities, that create that. That's why there seems to be a high rate of, traumatic syndrome. Depression is very common, clinical depression, stress, and also to find that comparing, studies in men and women, there's high rate of depression among women compared to men. If you look at studies done internationally, and in Pakistan, in Malaysia, and Saudi Arabia, it shows that low rate of suicide prevalence among the population. One would expect that. One would expect that there will be low rate of suicide because, we know suicide is haram. And also, there's another problem, possibly because of lack of reporting as well. But when you come to ideation, more or less, suicidal attempt or thinking about suicide is very common among women who experience all sorts of conflict or acculturation or intergenerational conflict. But we have to be careful about this data because, some of this data, they suffer from methodological problems and, excuse me, and, there's no reporting facility. So there's a lot of, you have to be very careful of looking at this data because, like I say, they have problems in terms of methodology or reporting. Now, anxiety and depression, especially attention deficit hyperactive disorder, conduct disorder, substance issues, alcoholism and gambling issues regarding attentive relationship, and psychosexual problems, domestic violence, and religious delusional behavior, they're all, problems among Muslim patients. So in the US, for example, and that's found in the UK, And in the United States, the common problem reported are anxiety, you have hate crime, stigma, and also, again, post 9/11, you have high rate of post-traumatic syndrome. Now, Muslims tend to attribute mental health problem to all sorts of phenomena. One, evil eye, which we call hasid, possession by supernatural entities such as jinn and magic. But also we know that, how the worldview of Muslims in terms of human suffering is that sometimes they regard it as a form of atonement for their sins, or it is trial or tribulation, or it's a test from Allah, or Allah is punishing them because they have done some bad deeds or they have committed sins. But also, psychiatric problem, mental health problem is a result of purification of the body and soul, or one is just straying away from the Quran and also from the sin. So how Muslims view mental health problems, these are some of these factors. It's the evil eye, it's the possession, magic, jinn, or it's atonement of sins, or it's part of life, calamities, a trial and tribulation, or tazkiyah, purification of the body and soul, or we have to move away, or our iman is not that strong. Our iman is very, very weak. A couple of myths, which just briefly want to look at, is that some people say it's not a real disease. No, mental illness or psychiatric disorders is not caused by weakness. It's not something weak mentally, rather than it's a medical disorder or psychosocial disorder. And the psychiatric disorders are not true medical illness like heart disease and diabetes, because people who have mental illness are crazy. So the fact is, it's a medical condition that disrupts a person's thinking, feeling, mood, and ability to relate to others and in their daily functioning. Because research has shown that there are, it's a multifactorial causation. It's caused by genetic factors or biological factors, even, imbalance of neurochemical transmitters. Another myth is that, I take an example of addiction. Addiction is our own fault. From an Islamic point of view, it is possible. I'm talking here from non-Islamic point of view. Myth, addiction is a lifestyle choices and shows a lack of willpower. People with substance abuse problems are morally weak or bad. And the fact is, addiction is a disease that generally results from changes in brain chemistry. It has nothing to do with being a bad person. What are the causes of mental illness? The causes of mental illness, as I said before, is a multifactorial causation. And if you look at the research does that, there are multiple interlinking causes. Genetics, environment, and lifestyle combine to influence whether someone develops a mental health condition. A stressful job or home life makes some people more, for example, susceptible. As do traumatic life events like, being a victim of a crime, or even have an accident, or being, racially abused or harassed. But there's also biochemical process and circuit, as well as the basic brain structure, and these also play a role in the development of causation of mental illness. Besides genetic or neurochemical, but also there are social problems. Again, poverty, domestic violence, isolation, physical abuse, sexual abuse, violence, aggression, poor housing, and also addiction. All these, but there's no single factor. There's sometimes a combination of factors, or what we call a multifactorial causation. Now, what are the type of mental illness? Very briefly, I mean, these are just some of the common ones. People have depression, everybody hear about it, anxiety states, schizophrenia, which is more psychosis, obsessional compulsive disorder. Some people have wish-washer, again, like obsession, eating disorders, anorexia disorder, bulimia, or problem. And now, especially eating disorders are very common among young Muslim women, and they are common in men as well, but in Western men, but in Muslim men, but and also people have bipolar disorders or happening. Now we focus on Jinn possession and mental health. I must declare that I'm not an expert on Jinn possession, but I have a bit of knowledge, but I'm still a student. So we know that in recent years there's been a lot of hype, in fact, of publicity about Jinn possession. In fact, it becomes so trendy, in fact, because it's easy to say we have Jinn mental health. But again, we have the publicity about Jinn possession, black magic, and that's many parts of the Muslim world anyway. And also there's a trend in terms of a business there, in terms of dealing with but that's another second issue. But if one listens to the symptoms, for those affected by the issues of those issues, now you can notice that some of the signs and symptoms are the same between Jinn possession and mental disorders. I think some of the signs are in the latest edition of what we call the DSM 5, which is it's a manual which is people, psychiatrists, and a lot of signs and symptoms, and you can categorize psychiatric disorders, but also in ICD-10, which is the international ICD-10. So, but what happened? These symptoms are similar between psychiatric disorders and Jinn. So most people are readily comfortable to propose that they have Jinn possession as opposed to have mental health problems. So that's common everywhere, wherever I've been of the world. Whatever I've seen or talked to people about, Muslim, whether it's in America, or whether in UK, or whether they rather, or in South Africa, they rather say that they have Jinn possession, which is acceptable in Islam, rather than mental health problem. Again, to do with stigma, to do with lots of other reasons. So people are more comfortable, with Jinn possession rather than saying they have mental problem. Now, what is Jinn? The word al-Jinni, plural, al-Jan, is an Arabic refers to something that is covered, that's concealed. Right? So the word Jinn itself infers that, or implies that there's something, an existence of something that cannot be seen. It's hidden, it's there. It's not there. You can't see it anyway. But we know that it is there. So, and we know from the Quran that the origin of Jinn is different from man, and interpretation of meanings. Surah 15, verse 20. That's what Allah says. Interpretation of meaning. And indeed, we created man from sounding clay, of also black smoke mud, and the Jinn we created for time from smoke, stain of fire. Okay, you can see the difference between man and Jinn in terms of how they were created. One with sound clay or the black smoke mud, and the other one with smoking clay. And we know from several verses of the Quran, I'm going to go into it, about how Jinn share distinctive characteristics with human beings. Some of it, not all. They have intellect. They have free will. Some of them are obedient to God. Some of them are believers. Some of them are non-believers. They nourish their body with food, but not the same food as we have. They nourish the food with dung and bones. And so they are different. But and some people believe, according to Phillips, that some people believe that jinn possess some divine qualities. And they can know everything, they can say everything, and that is not part of Islamic writing. So in Islamic writing, true jinn possession can cause a person to have seizures and to speak in an incomplete language. So people can have what we call epileptic fit or some type of seizure, but also people speaking what we call tongues, which means some language which they never even talked about before. Now, what are these symptoms? And some people divide it in three parts, in three categories. Those which occur when one is awake, those which occur when one is asleep, or sometimes there's some changes in behavior, and it, as if, this is not the character of the person, this is not the temperament of the person, this is not what the baseline behavior is. They suddenly they change. It's like we say, out of character. But again, some scholars would say that we have to pay attention to 6 categories of jinns. The one appointed to whisper at the time of salat, especially when we did away wudu and we stop salat, because they don't do it in adhan time because they ran away. But once salat stops, they stop whispering. There's one who likes to separate husband and wife, creating marital dispute. The one who triggers all sorts of fights among people, business, and so forth. The one who beautifies lives to people. He makes everything beautiful. He makes haram thing beautiful. He makes, halal thing ugly. So people choose beauty people. And one who is spared at the time of calamities, of trial and tribulation. And also the one who makes people fall into zina or into adultery. So there are some scholars say there are 6 categories of these jinns which we need to pay attention. Now, those with jinn possession tend to appear to suffer from all these different disorders: depression, anxiety. People get physically ill. People hear voices, or having tactile hallucination, touching, marital dispute, sexual problem, and also in some cases, you have, things like housing, the material professional damage, fire, and so forth. So this is how, jinn possession appear, to suffer from intense fear and psychological disorder. When one is awake, you can notice sometimes people, if they have jinn possession, they're going to run away. They're going to turn away from actual worship. They can't hear the Quran. They don't want to remember Allah, no dhikr. And when they read of the Quran, they can get aggressive, or they push people away and so forth. And we know that Allah said in the Quran that it's official meaning that whoever turns away blindly from the remembrance of Allah, we appoint for him the shaitan to the Karim. The Karim is a companion that's with you all the time and whisper to you all the time, especially in Salat. And very the shaitan hinders them from the path of Allah, and they think that they're guided all that. So these people tend to have all sorts of behavior, erratic behavior which is out of character, behavior which is not consistent with the normal baseline behavior in the things they say, in the things they do, and so forth. There's also the question of seizures. These seizures or epileptic fit sometimes, there's no medical cause, there's no organic cause. And these are signs that these particular fits or seizures have some sort of character, shaitan character that causes. Some people have paralysis of the limb. Again, there's no organic cause. There's nothing physically or organically wrong with the person, but one of the limbs is paralyzed, they can't move it. As if, some people have, those who have a stroke. Sometimes they have what they call plastic paralysis, which means, the hand goes down, you can't hold it. These people can become very irritable, can become angry or weak. So there's an incoherence in their behavior, in the sense of, where they have to love, they cry, when they cry, love, and so forth, and there's no apparent causes, and people get very sensitive, either showing aggression or showing tears. Whether one sitting in the toilet all the time, that's what some people say, but again, don't do oneself, but again, that's maybe, we all in some ways talk to ourselves sometimes anyway. Constant headache, I think that's a very important one, because again, people have constant headache and there's no explanation, no matter how many painkiller they take and so forth, and it doesn't make any difference, and it's constant, and that makes people irritable and so forth. So that's one. Irregular menstruation in women. And also we find that some husband and wife cannot have children, although they're physically or psychologically healthy, but they are unable to produce. And and also depression. Here depression is not necessarily what we call clinical depression, from my experience, to do with intense sadness. And it's widespread. It's in fact one of the widespread. And because some people have mild sadness or feeling blues, this is natural emotion, normal emotion, which hardly anyone can escape, not even a believer. But in this type of depression, this sadness increase and take over a person, and this later on can become clinical depression. People have frightening nightmare, which again, seeing all sorts of creatures, having hallucinations, seeing ghosts, apparitions, or even, illusion. And people have insomnia, which means lack of sleep. I'm sorry about that, I can't control that. Sorry about that. I switched to everything else, but people are trying to contact me, and I do apologize. Let's go back. So we have people have all sorts of nightmares. Bad, it's not just dreams. It's about very bad dreams and apparitions. And people have, like, can't sleep, anxiety, and they have fear of waking. Again, that could be a sign of depression as well. Talking loud in one's sleep and moaning and going. And some people have delusion. They have false belief. Epilepsy, as we mentioned already, people have epilepsy, and again, there is no organic cause, and it's not caused by Jinn possession. In fact, in the West, many doctors, acknowledge it. But among Muslims, sometimes, we don't even, sometimes, strange that many people deny this among Muslims. There was many doctors that acknowledged that this kind of epilepsy that they don't know the reason why. There's no other causes apart from, some sort of possession. Spirit, if you look at American, the DSM, what we talked about before, the manual for diagnosing, but speech person is not recognized. But, it's state of this, what we call dissociative disorders, diagnostic, or what we call cultural bounds. I won't be able to have time to explain all these, but you can check it. And also, trance and possession disorders are classified as dissociative disorders. In fact, disorders where there's a loss of sense of personal belonging and loss of belonging and identity, or you're not aware of their surroundings. So in clinical variety, both mental health problems exist and have slightly different symptoms and widely different causes. However, in some cases, there is a mixture of both Jinn possession and mental. But I think that's it's very rare that people would have both together. It's very rare. Some people do have Jinn possession and mental problem, but very rare that they have both at the same time. A lot of clients I get, which is referred from somebody, an imam, basically they're already going through and they don't have Jinn problems. They tend to have depression, anxiety, obsession, or marital problems. But again, as we said previously, there's a lot of overlap between Jinn possession and symptoms of mental health problem, and sometimes it can be seen as one of the same thing. Now, it's common for people with to confuse what we call dissociative disorders. And as I said, the dissociative disorders is to do with somebody who have a total loss of sense of personal identity. They don't know who they are. They have like a, in a way, inverted commas, split personality. And they're not aware of the surroundings. But you find that also in schizophrenia, and so there is that in Jinn possession, but also in schizophrenia. So people can be confused, that that people are having schizophrenia, or they could have Jinn possession. But the difference is that in schizophrenia you have delusional aspect. And this delusional aspect is associated with interpreted as dissociation. Now, the difference is that with schizophrenia, there's not that physical experience. But in Jinn possession, there's that physical experience. There's that physical evidence, which is clear in Jinn possession as compared to schizophrenia. We can move on from there. Now, there's also some other symptoms which are found in both. Sometimes there's a change. People become suspicious in the relationship, rejecting one or the partner or wife, or little things become big things. Anyway, people shut down. And you find that in schizophrenia as well, and depression. So, sometimes spouse getting each other's face, or seeing each other's face have been ugly, and these are found. And the second thing, like some people can have, excessive love for one wife, or desire for frequent physical relationship, or feeling restless and so forth. And again, these are found in patients suffering from hypomania. Hypomania means, people who are very, very overactive. Simply. There are other symptoms. For example, some people People might see things, small things look big, or big things look small, you know. And these are found, in psychological disease, especially some people who suffer from epilepsy, but what we call temporal lobe epilepsy, part of the brain, the temporal lobes affected, and this creates a sort of illusion where, you know, small things become big and big things become small. This is similar. Now, excessive talking, not stopping in one place, again, you find that in Jinn possession, but also you find this in people with hypomania, which was mentioned before. Other symptoms of this magic are anxiety and not caring about appearance. Again, you find that in people with depression, they just, you know, look after themselves physically, and also people suffering from schizophrenia. Some people remain completely detached, aloof, and you know, silent. They have constant headache, you know, dislike, you know, social gathering. Again, we find that with people mainly in depression, right? But in some cases, schizophrenia as well. People have some sort of social phobia, and where they don't want to meet people as well. Again, you find that same between him and mental health problems. We talk already about dreams, and this again with anxiety. And sometimes people have hallucinations, all type of hallucination. You know, you can have hallucinations of all the five senses. We already mentioned it again about doubt. People have suspicion, you know, doubt. And this is what Shaitan creates, you know, and, you know, create doubts and certainties, desires as well. And you find that with patients, especially with people who are paranoid. People are paranoid tend to have delusion. They think that people are going to kill them, people are going to poison them, people are going to do all sorts of you know, talking about them as well. You know, sometimes people think, oh, you know, they always talk about me, and you know, they whisper and so forth. And these are, you know, sometimes, you know, that's true sometimes, but most in case pathological cases, people cause and then pain everywhere, pain, you know, all part of the body, you know, and all, you know, people suffering from, you know, and sometimes people have physical disease, they have these things anyway, these pains, but you know, the pain is not there. Again, you find people who have amputation, for example. We have what we call phantom pain. You know, they have the legs amputated, especially people with diabetes sometimes, unfortunately, you know, and they still have pain in the leg that's amputated, what we call phantom pain. Again, it's not there, but in people, same difference between physical illness and also gene, you know. And touching, when it's not, you know, so it's not all symptoms of psychosis, because again, you know, sometimes it is black magic, but also touching, what we call tactile hallucination. Some people consume drugs, you know, and alcoholic, for example, I remember the patient who's alcoholic, and he felt that there were insects crawling under his skin. Basically, he jumped out of bed, you know, because, you know, of tactile, you know, because this is the result, consequences of chronic alcoholism. You know. So drugs, you know, cannabis, marijuana, heroin, liquor, any alcoholic beverage, and also like magic makers, you know, tactile hallucination. Hearing voices in this common in patient with schizophrenia, and you know, patient with also feel presence of some idols and human person when they are not present, and like I said, small people, big people, small and so forth, and sometimes today we trade. Very quickly, 3 case studies. I think that's time. This is a woman suffering from anxiety, showing restlessness and insomnia. She was taken in the witch doctor's wrong thing there to heal her, give her taboos or taboos, whatever they call it in different parts of the world. It's something that you put something on it and you put it on your neck or carry it for drinking water or anything. But when this didn't work, she was hospitalized and basically she was, diagnosed as depression. And she used to forbid her husband coming near her because, because of the taboos, precious, and also, you couldn't have intimacy because she's wearing, this very, very important thing. And that create all sorts of problems in the relationship and consequently, anyway, afterwards, after counseling, she had some sort of pharmacological intervention. She she got better and so forth. And then she found out that that is not important. So she was treated with medication and also counseling. Another case study, sorry, it's all women, but we won't show those men as well. But there's no history about this person in terms of psychiatric history, and the person became withdrawn, stopped communicate with people, and sort of extreme sort of phobia, and stopped eating and drinking. And they found that there was no organic disease, and and severe depressive illness was in fact, but again, the family and she underwent, because of the severe depression, probably there was a element of suicidal tendencies there. So she was given the therapy, and but the family wasn't happy about it. They thought she was possessed by Jinn, and so but and they didn't want to talk about to the doctors. And anyway, she was treated later on, and after a session of Rukia, her condition improved and she resumed eating and drinking. And in fact, she had no explanation what happened. Basically, she remained in the yard without medication, so she was treated. So she basically didn't have depression, but she had problem. Jinn. And the third one, again, somebody experienced high fever, confusion, and her speech became incoherent, and and doctor physician diagnosed her having some sort of typhoid fever, and prescribed antibiotics, and the family. Okay, she was taken to a local pay healer, and she was treated in the sort of program Islamic way. But, her didn't work anyway, because she carried on having all sorts of problems and also having epileptic seizures. And on physical examination, she was found to have problems with basically she was jaundice. And she had a swelling of the liver. Basically, she had a condition of enlarged liver, but also enlarged spleen, and that's why she had jaundice. And in fact, she was found not to have Jinn problem, but she had malaria, and she was treated. Again, you can see sometimes the physical disorders and people think Jinn, and sometimes the Jinn people think it is psychological, physical disorders. Now, these cases illustrate how difficult sometimes it is. The interaction between cultural belief and conventional medicine, and in case of people are alleged to have Jinn possession, you need to try to exclude also the physical organic problems and any problems with mental disorder. Mental health problems should be treated using the conventional psychiatric method, about sometimes medication to start with, and with counseling, psychotherapy, and so forth. Anyway, and also sometimes when the problem when traditional medicine conflicts with culture or religion or belief, then the whole therapy, the whole rapport, the whole relation thing. But most people are content to utilize that for treatment without giving that traditional explanation. Yeah, so there's sometimes a strong case, involving imam or Rashida in some of these cases. And again, there's somebody who's going to talk about this. So in conclusion, and is that we know that the large, significant amount of people living in the West, Muslims, and we need to understand the mental health needs of this community. We also know that our religious belief and practice have an impact on mental health in individual families and communities. And sometimes the lack of understanding of the interplay between the religious influence on health or sickness behavior can have a significant effect upon access to care, but also delivery of care in terms of whether it's counseling or traditional form of treatment. I'll stop now. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Now, since you apologize about all these calls and Skype. I think it's question time. Am I correct? Yeah.
Jazakallah khair, Dr. Rassool. Let's have the Q&A session, right? We are running short of time, inshallah. So shall we start the Q&A session? Okay, what I'll do, Dr. Hussein Rassool, I'll just quickly read the question for you, inshallah, and then you can address to that question. Is that fine, Dr. Rassool?
Yes, that's fine. Correct. Yeah, that's correct.
Okay, inshallah. Fine. We have a question here. How to differentiate between hallucinate and ghost? I'll type the question.
Hallucination. Yeah, hallucination. Hallucination is that, there's nothing there. It was an illusion. There's something there. For example, for illusion, you find the curtain moving and you think there's somebody doing the curtain, but there's nothing there. That's illusion. Hallucination, there's nothing there. Ghosts, it's there's nothing there, but people experience it. This is their worldview. This is their reality. I can't, like I say, I'm not an expert on it. So I can tell you, I've never seen a ghost, so I don't know. But sometimes you can feel the presence of something which is not correct. So it is very subjective experience.
Okay. Well, there is another question, Dr. Hussein Rassool. Does magic resemble anxiety disorder?
No, I mean, we all suffer from sometimes a little bit of anxiety. And anxiety sometimes is quite a motivating factor because it's good, it motivates us. But sometimes it's too much, we can't do anything. No, it doesn't. But as a result of magic, you could suffer from depression or schizophrenia, or so it could be the consequences of magic. That people, I don't think people have anxiety disorder. I suppose you may have, but it is very, very severe. So it doesn't resemble it. It could be the consequences of it. Okay.
Fine. There is another. There is another interesting question here. Interesting question. Can we be the friend with good jinn for our good reasons?
No, according to our Aqidah. No Aqidah Ahlus Sunnah wal Jama'ah. No, there's no, we can't. I'm sure Dr. Bilal Khalid mentioned that as well. No.
Okay, fine.
For our good reasons. Next
Okay,
one.
here is another question. Yeah, there is another question, Dr. Rassool. What causes jinn possessions and what cures it?
What causes Jinn possession? That's a very interesting. It could be to do with. I mean, there are two types. Where it could be direct thing, something that somebody do something to you, or something indirect. If something happened that you are passing by somewhere, or you go to a house which you didn't inhabited in that. So you can get it from direct or indirect. But what causes it? Allah knows best. Allah. But we know that is shaitan. And so evil people do it. People use shaitan to do their work. And what cures it? Ruqya. Follow the Quran, follow the Sunnah. That's the only way. There's no tabiz, there's nothing else. Quran and Sunnah. That's what's going to cure it.
Okay. There is a question here. Some imams really beat other people thinking they have jinn. How would you advise on how to draw the line between possession and mental disorder?
Yeah, I mean, I've heard it. I think something happened in the UK, in England, where somebody beat a young girl and she died, unfortunately. And I mean, I can't comment on it, but all I can say is that one has to be very, very careful, be very cautious. There's beating and slight beating. There's challenging and physical moving, but also there's pure aggression. So again, it's to do with the person, and we have to comment on that. I'm happy to draw landing for mental disorder. Like I said, the symptoms are the same. It's through tests. You can test. Both of them can be tested. The only way you can do it is by testing. Ruqya, or you can get an assessment of somebody using all sorts of whether it's mental disorder or not. Like I said, sometimes people have both. It's very, very. This happening can again murder person.
Fine. There is another question, Dr. Hussein Rassool. In your experience, what is the main difference between jinn possession and mental health issues?
The difference in terms of the symptom, like I said, the sign and symptom are very similar. Sometimes it's very, very hard. But if you start doing ruqya or something, and they're getting everything, they can't. They're trying to push you. And somebody who is I'm not qualified in it, somebody is qualified in Islam, we're able to tell you this is person have jinn possession. But the symptom will be similar to somebody having mental health problems. So that's the difference.
Okay. Can the epilepsy related to jinn possession assessed by EEG and MRI?
That's a good question. I don't know. No, because I would think, just my opinion, okay, I may be wrong, correct me please, anybody. I would think that they won't, no, because if there's no organic causes, then you won't choose. That's my opinion, okay? Please, you better check it. It's pure opinion. I don't have a fact for that. But I would think that, if there's no organic causes, it won't show. But if it shows, then I may be wrong. But I doubt it very much. Yes, okay. It's related. Yeah. Go on.
Okay. Next question, Dr. Rassool. From Hadith, jinn lurk in bathrooms and graveyards and places like such. Any correlation between possession and those who spend a lot of time in places like that?
Okay, that's why when you go to the bathroom, before you enter the bathroom, you seek refuge in Allah. That's common. That you should do that, And especially jinn-like, to be very, very careful always seek refuge before you enter the bathroom. You know, say in the bathroom. Greater, but also not only greater, but also houses that are not inhabited. You know, if a house is not inhabited for a long time, you know, you find jinn tend to go there. A correlation people and those spend a lot of time. There's that type of. I don't know. It depends what you do there in those places, but I mean, you know, but also always do prevention. You know, why wait until it happens? You know, seek refuge. You know, seek refuge in Allah. You know, that's the most important thing first. And then, you know, if you spend time there for some bad reason, then it's okay.
Okay, fine. Similar question again. What is the basic difference between jinn and disorder? How we can differentiate it?
How is it coming up on the board? How is, sorry? Can you say it again?
What is the basic difference?
And disorder, how to? Like I said, sometimes we can't differentiate it unless you're an expert. You know, you know, like I said, you know, I sometimes work with Imam. Okay. We work together, and you know, they sometimes, you know, he would send me people who have, by doing ruqya, you found that they don't have jinn problem. They have problem, you know, to do with depression or anxiety. Yeah. So it's by doing tests like ruqya, or then you can find out what the people, like I say, very, in fact, you know, just yesterday I had, you know, somebody rang me and not to say a patient. That patient is very rare. She's got both mental health problem and jinn possession. So she's still having ruqya, but she's still coming to see me for, you know, Islamic counseling and psychotherapy. So she got both anyway. Yeah, but that's very rare. Yeah, both. Okay. Next one.
Okay. Next question is, my husband feels jinn sitting in his hand. What should we do to cure? Does hijack helps with that?
Right. I mean, that's again seeking refuge in Allah. For example, after each salat, you know, read, you know, Qul A'udhu bil Falaq, Qul A'udhu bin Nas, you know, Qul Allahu Ahad, the 3 calls. You know, you read it, you know, 3 times. Maghrib prayer. And also Fajr prayer, you read it. You read it before you go. You read it before you go to sleep, and you read it before you go to sleep. If your husband feels jinn sitting in his hand, again, I can't comment on that. But what I'm saying to you, he's got to read. He's got to use the trick all the time. You know, somebody mentioned about Surah Baqarah. In fact, it said, you know, the Lord's trailer of Surah Baqarah. You know, if you don't want, you know, jinn to be in your house, you have Surah Baqarah all the time. You know, you read it, or you recite it, or you hear it. You know.
Okay. It seems to be advice here. Needs your advice here. Jinn possession happened with one of my relatives. It's been 2 years and still the same effects happen.
Yeah, but I mean, sometimes people try to look at magic cure. There's no magic bullet. In fact, you know, one of the imam told me, you know, sometimes you've got people coming to him and ask, you know, give me that special dua that's going to cure everything. There's no such a thing. There's no such a thing as magic dua or magic pills. Yeah. So sometimes you know, we need to test, you know, trial and tribulation. Sometimes it's test. You know, sometimes we just have to wait. Anyway. It could be that, I don't know the case. It could be sometimes it's to do with, you know, the problem of, you know, the effect of jinn possession, you know, or the person may have problems, you know, to do with mental health problems. I don't know the case. I'm just, you know, generalizing there. But, you know, this is, you know, sometimes we need to have patience with it. It doesn't happen in one session. Sometimes that's what people happen. They go one session and that's it. Again, it's 2 years, it's a long time. But again, you know, there may be a reason for it. We don't know. Like purpose for it as well.
Okay, we'll take another 3 or 4 questions and then we will wind up the session. Here is a question, a case basically. A 16-year-old girl has been affected by the jinn possession for more than 5 years, and she often being scratched at her bodies and throw up blood. She don't want to perform salah. Ustad has performed ruqya on her, but the jinn is quite strong. It's laughing at him and boggle. The girl said she has.
She has what?
That's the end of the question. The girl said she has.
Okay. Again, you know, Allah knows best, anyway, Allah will. But again, you know, if I could comment on this, but what I'm saying is that, you know, this is probably, you know, some of the sign there to do with Jinn possession, and, you know, and it takes time. For more than 5 years. How long has she had, you know, ruqya? That's the thing as well. And like I say, it's very difficult to comment on cases like that unless you find out, you know, you do a proper assessment. I need to do a proper assessment. I just can't comment too much. But what I'm saying is that, you know, yes, the jinn is strong. Yeah. But you shouldn't give up. You know, as long as we use the Quran, and Sunnah.
Okay. The next question is, what are the unacceptable ways of treating jinn possession?
What do you think? Running tabbies around your neck, and you know, looking at, you know, and you know, go and pray saints, you know, and murids, and, you know, do all sorts of things that's not acceptable within, you know, our Akida. So yeah, there are a lot of there are non-Muslim treatment or therapies that you can have, you know, which is not acceptable within Islam, that, you know, sometimes people do. So yeah, these are anything that's not found in the Quran and Sunnah. It's clear, and outside that, it's not acceptable.
Okay, a short question here: how to protect oneself from jinn?
As I said before, you know, you want to protect yourself. The trickle, you read 3 times each in Salatul Fajr. I would, you know, advisable to read in every, you know, every Salat. But also, Salatul Maghrib, you read 3 times before you go to bed. You know, you read it 3 times, and you know that, you know, Ayat al-Kursi also, you know, is useful. And you know, this is how you protect yourself. When you leave the house, you make dua. You enter the bathroom, you make dua. You know, and you leave. All these are protection. These protection are free. We don't have to go to, you know, buy anything from anybody. You know, so we can, you know, do that. It should be part of our armor to defeat shaitan. Shaitan's going to be there. They're going to be tested us all the time, you know, especially when in Salat, it play with us, you know, it tried to make us give us distraction. But nevertheless, you know, we are human. Sometimes we fall into the trap, but at the same time, we can protect ourselves by the trickle. Surah Fatiha, you know, two things about, you know, Surah Fatiha, you know, for Ruqya. This is we know quite well, Surah Fatiha is Shifa. Yeah? And there's, you know, evidence from authentic hadith about this as well. Okay, next one.
Next one is how to know whether disease is due to magic or it is some health problem like schizophrenia. I hope I pronounced it correctly.
Again, if you do a proper assessment, look at the person's culture. The Muslim, you know where it's come from, you know, what the culture is, what the worldview is, you know, how they view illness, and sometimes, you know, again, by doing tests, by doing ruqya, you can. And, you know, sometimes, like I say, it's easy sometimes to say that we have jinn possession rather than schizophrenia. But sometimes, you know, people who, you know, have schizophrenia look as if they have possessed by jinn. So you do what I'm saying, test, but I mean, test is just like filter like that. But again, like I said, a lay person is difficult to find out because you don't know what you're looking for. Was a professional with a lot of experience in transcultural psychiatry, you know, they'll be able they'll be able to advise you.
Okay. Okay, fine. Well, one last question in just a minute, Dr. Hussein Rassool, because we are going to start another session on pregnancy depression by Sister Bila Khan. Just 4 minutes to go. So let's have one quick question, inshallah, and then we'll close the session. And our question is, can ladies do ruqya or heal jinns?
That's interesting. I don't know. I love it. I don't know. I never, but I mean, you can do it. You can read, you can do it yourself. But, again, I'm not into the detail of it. Some people say, if you do it on yourself, then you don't go to paradise. That's the one story. But anyway, you can, I would think that, I don't know. I think, because you can read the Quran, so that's my personal opinion.
Okay, Jazakallah Khair, Dr. Hussein Rassool. I understand a lot of you have many questions to ask. Inshallah, we'll try to have another session from Dr. Hussein, inshallah, sometime soon. But for now, we'll close the session, inshallah. Jazakallah Khair, Dr. Hussein Rassool, for joining us and giving us such an enlightening talk on this very, very interesting topic. Jazakallah Khair, Sheikh. And inshallah, we'll close the session. And before that, I'll also like to thank the participants for joining us and making this session successful. Jazakallah Khair again. Inshallah, we'll close the session. Subhanaka Allahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk.
Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for coming. Thank you for participating. And I've learned a lot from you. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.